Hi, my name is Farrah. I'm going to be doing my wound care dressing change today. Prior to going into my patient's room, I'm going to ensure that I verify my doctor's orders, gathered all my equipment. I'm also, once I enter the room, going to verify that I have the correct patient. So I'm going to ask them name and date of birth and check the wristband. Once I've completed that, I'm going to perform hand hygiene and don my clean gloves. So put on my clean gloves. Once I put on my clean gloves, I am going to remove the soiled dressing. So do it like this, and if it's sticking to the skin, you can use an alcohol pad and kind of press up against it. Can help not hurt the patient as bad. And when I do this, I'm going to look at the soiled dressing and take a mental note of the color, the amount, any abnormalities in the drainage here. And so once I've noted that, I'm going to fold this up, throw it in a biohazard bag, and I'm going to remove these gloves and perform hand hygiene. So, let's see, remove the gloves. Once I perform hand hygiene, I like to go ahead and get my tape ready because I'm going to need it at the end. So I like to do it before I have gloves on again because the gloves just make it hard. So I'm going to do it just like that. Clean my hands, boom, and apply another pair of clean gloves. So I have my clean gloves on, and now I'm going to pour my sterile dressing, or my sterile water, sorry. So I pour my sterile water. Once I've done that, I am going to begin cleaning my wound. So you're going to clean it from inner to outer, so clean to dirty. So just like this, starting away from me. So boom, get another one. And boom. And you're gonna throw these away. And then you're gonna go right down the middle with the last one. Boom. Throw it away. Once I do that, I'm gonna proceed to dry the wound the same way that I cleaned it. So away, dry, throw it away. Dry, throw it away. And dry. Once I've completed that, I am going to put a dry gauze on top of the wound. And then I'm going to get my ABD pad, take it out of the packaging, and lay it across just like this. And get my handy dandy tape that I prepared for myself earlier. Tape it down. And tape it down. And I've seen in clinical settings where people will initial and put the time and date just so that way there's no misunderstanding of who did it and when it was done. Then I'm going to remove my gloves and perform hand hygiene. Once I perform my hand hygiene, I'm going to leave the room and document. So when I document, I'm going to document that the procedure was done, and I'm going to document how the patient handled the procedure, if it was painful, if it was not. Then I'm also going to document any type of drainage that I saw, and I'm also going to document the way the incision was. If there's any abnormalities, any redness, swelling, anything like that, I'm going to document that. And once I finish that, I'm finished.